Rehab for a Microdiscectomy by Sadie Laster. A microdiscectomy is a surgery for a herniated disc, also called a slip disc. Essentially, the vertebrae, or the bones in our spine, have a thin jelly-like substance or a disc in between them that keeps them from rubbing together and lets them move fluidly. Sometimes the inner center of this, called the nucleus, will push out into the outer circle, called the annulus, and this will cause a herniated disc. Sometimes it can push all the way through, as we can see in that photo on the right. About this injury, it's commonly in the lumbar spine, which is lower, or in the cervical spine, which is in the neck region. It's common in sports such as football, wrestling, hockey, gymnastics, tennis, and golf, because there's lots of flexion, rotation, and compression in these sports. It's also common between ages of 30 and 50, men, smokers, heavy lifters, frequent drivers, people with high weights, and people who are more sedentary. As well, it takes only 2 to 12 weeks to recover, and in many cases only improve after 2 to 3 weeks. Usually this doesn't need surgery, but if particularly bad, it does. Usually this is gotten by disc degradation over time, just gradual aging of the discs, or lifting improperly, such as lifting with your back instead of your legs. The injury itself has a lot of symptoms, mainly pain or numbness or weakness throughout the body, as well as tingling or sciatica in the legs, and pain that can get worse when doing stuff like sneezing, coughing, or laughing. See a doctor if your neck or back pain travels down your arm or leg. If there is numbness, tingling, or weakness as well, you want to see a doctor. Doctors will typically recommend surgery if after 6 weeks you see no improvement in your symptoms, especially if you continue to have poorly controlled pain, numbness or weakness, trouble standing or walking, and or loss of bladder control. This typically means that a nerve is being compressed upon, of which you will need surgery for. Some prevention just for this injury in general is you want to do some exercise, especially that'll help your trunk muscles, and you want to quit smoking, like I said earlier, practice good posture, maintain a healthy weight, use proper mechanics for everything, especially when lifting, stretch, and avoid wearing high heels, which can cause a herniated disc over time. The surgery itself, as I said earlier, is a microdiscectomy. This relieves the pain and symptoms of a herniated disc because it presses into the adjacent nerve root. Typically, this is removing a small part of the nucleus that spills out, not the whole disc, but sometimes you will need that. The surgery is not that invasive, it's minimally invasive, and doesn't disrupt a lot of the tissues in the lower back. That's why it's popular now. A discectomy is similar, but that's the general surgery where a much larger incision is opened up. And as time went on, the microdiscectomy is being used lots more because it's using these new technologies to cause less damage, which I'll touch on in the next slide. Basically, it causes much smaller incisions, as you can see on the image in the right. She has a very small scar. And due to this, there's less chance of trauma, infection, or excessive bleeding. The recovery time is much shorter in general. Some studies even show that this will cause less of a repeat than in other surgeries. Specifically, this is done through 3 different methods. Midline method, where they just make it and then kind of tear it open. This is more similar to a discectomy, actually. Tubular, they inject a bunch of little tubes inside the vertebrae or back so they can have a little corridor or tunnel to operate in. Or the most common method, the endoscopic method, where they insert cameras, microscopes, kind of see on the right here, and then they just look with cameras through that in real time. The whole method itself is done with the surgeon pulling the nerve by removing small fragments of the bone, ligament, and disc to free it. And like I said earlier, only a small part of the disc is typically removed, but sometimes it will be, and then you'll need a bone graft, but that's a different issue. Now, some issues with this surgery, as in any surgery, there will be complications. They may not resolve it completely. They could get things wrong. Sometimes the herniated disc itself will damage the nerve, so even if you get the surgery, it won't fully heal right away or even really fast. It could cause some difficulty walking, balancing, or bladder problems. Mainly, it's not the surgery itself, but just the damage from the initial injury that will cause you some pain. Other treatments you might want to do as prescribed by your doctor are different medications. You can do over-the-counter medications such as Tylenol, Advil, or Aleve. You can do some neuropathic drugs if you have a lot of nerve damage. If you have muscle spasms, you can look into muscle relaxers and opioids if your doctor recommends them. Those are very addictive though, so maybe not. Some home treatments, especially as you want to do some cold to reduce the pain and swelling and inflammation early on, but you do want to do some heat later on for relief and comfort as your doctor recommends. But you don't want to bed rest too long. It's good to rest, of course, but you don't want to rest for more than 30 minutes. Then you want to get up and do a little bit of activity, and then you can rest again. And you want to resume activity very slowly. Don't get up too fast. Don't resume back into exercise really soon. especially when avoiding, what you need to avoid when going into this rehab program is heavy lifting, sudden pressure on your back, repetitive strenuous activities, stuff like that. Avoid lots of exercise or exercise that causes your pain to get worse. Avoid hamstring exercises, and when experiencing sciatic and tingling, avoid high impact exercises like jogging or martial arts, because those can jostle your spine a little more, and we don't want that. Okay, so here's the timeline for the rehab phases. We have phase 1, which is the reducing inflammation phase. Phase 2, we're going to up that strength. Phase 3, which is more advanced strength and rotational power development phase. This is also going to be some more flexibility. And phase 4 is the full return to sports. It's between phase 3 and 4 that will focus on plyometrics as well. Only begin to do sports-specific activity once you gain full strength and pain-free mobility. As well, you want your athlete to be confident in their ability to perform at intense levels without fear of pain, so they can really return to their sport. So don't progress to any of these levels unless you've accomplished what they're intended for to the highest of ability. The first phase, as I touched on, is the initial rehab phase. This is going to last about from the beginning to 2 weeks on. Your goal is to reduce pain and inflammation. You want to minimize that lower extremity radiating pain. You want to be able to move independently and safely, and educate yourself on good spinal mechanics and posture. You want to understand pacing as well, and don't overload yourself. Keep using these ice methods and other techniques that your doctor may recommend you. Avoid sitting too long. I touched on this. Even when driving, typically patients are not cleared for driving right away because they'll be sitting for too long. As well, don't do too much bending, twisting, pushing, or pulling. And don't lift more than 15 pounds, which is about a gallon of milk. So you might want to get someone like a caretaker to help you. Some exercises that are good for this stage is light stretching, especially for your hip flexors, quads. Don't go too heavy on the hamstrings, but that as well, and your calves. You want to do some glute sets, mini bridges, planks, and you could do a light walking program. Don't go overload, and bobbing duck. If you've ever seen those little drinking like bird things, that's what that basically means. And we go on to strengthening. This is the second stage. It lasts 2 to 6 weeks, and you want to reestablish some of that neuromuscular recruitment, which means get a little stronger and get your nerves back to how they were before. You want to make sure to keep your lumbar spine neutral and avoid that bending and twisting again, and you can start lifting a little heavier. Exercises that are good for this, once again, your glute bridges are really great for this. You want to do some hip extension exercises. You can do some stepping exercises up, forward, and then over blocks as well. Wall squats, all those sort of regular exercises. Don't overload it. You don't want to do too many at once. And bird dog, which is basically a stretch you can see on the very bottom. Next, we're going to get into the advanced strength and power development phase. This is sort of a encompassing phase that I saw a lot when I researched. This is going to build up that flexibility, strength, power, and some of those beginning plyometric skills. You want to prioritize maintaining your trunk and neutral spine position. Focus on your proper mechanics and control. Here, we're going to do some of the other exercises, but at higher reps and sets and with higher weights. You want to increase your walking here, and you want to use stuff like the stationary bike, elliptical, or treadmill. These machines can help us, but not be too intense. As well, you can even start to do some outdoor biking, swimming, or yoga. And the final stage, which is return to sports or working. Here, we're going to do some more intense running or plyometric drills and agility drills, and we're going to do some sport-specific exercises, but you only want to do this once you've achieved full pain-free RRM, strength, and power have been achieved. You don't want to have any of the different neurological symptoms like tingling or weakness. That's going to be no-go. And you want to complete a sport-specific functional training program based on what your coaches say and what your doctor says. If you're a coach, make sure you consider the safety of your player as well and the safety of the other members of your team before letting someone go back to their activity. Thank you. I hope this was educational.